The last one would be the hip. And I break the hip into, first off, treating if I'm treating muscular pain. So if we feel the greater trochanter, so a lot of these dogs will be sore in the gluteal region, so we'll treat here. And a lot of dogs that have had a chronic hindlimb lameness, if you squeeze kind of in the proximal quads, they'll be uncomfortable here. I'll treat this as well. But you got to remember the hip, if you're looking direct in at the greater trochanter, the hip doesn't come straight in. There's a little bit of what we call anteversion. So the femoral head's actually pointed cranially a little bit. So if we've got our greater trochanter, I'm going to drop just cranial to that. And that's going to be in the region of the actual hip joint. Now you can treat caudally to the greater trochanter, but you need to be very careful because the sciatic nerve runs right down this little sciatic trap. So it's coming off of around the ilium and it's crossing just caudal to the greater trochanter. So typically my landmark when I'm treating in the hip is we're going to stay cranial to the greater trochanter. And we're going to treat cranial and kind of in this area right here. And if I'm treating gluteals and soft tissues, we're treating sort of this area up here from the ilial wing to the greater trochanter up in this region. So again, I'm going to find my greater trochanter. I'm going to split the hair to get down to the skin. And then I'm just going to, if I'm treating the hip, it's actually a relatively small area. So I can feel this butted up against the greater trochanter, so that's kind of where I'm staying. If I was going to treat the gluteals, then what I'm going to do is I'm just going to come, I'm going to palpate my ilial wing, and I'm going to come just lateral, and we're going to find our skin. And in this area, we're typically treating a little bit larger of an area. So I'm kind of treating around the circumference of the greater trochanter just to get all of the area of the gluteals.